Public health is in the center of attention now more than ever. Every time you scroll through your favorite social media app, I am sure that you see content that is public health related. If you do not think that this is true, then let me explain to you another way. There is a random post in your Facebook feed from a page that you do not follow that details a local COVID-19 mandate requiring you to wear a mask when you go to your local grocery store. That is public health policy. Here is another example. Watching a YouTube video that is reporting that another beautiful and successful Black woman has died prior to giving birth, and she was not even a day over 30 years old. That is maternal and child mortality and health disparities. Or another video going viral on Twitter of another Black man who was killed by the hands of police brutality, leaving us waiting for a response, and as anticipated, there is no justice for his family. That is public health violence and mental health. Now are you convinced? Regardless if you are convinced or not, the reality is that people dismiss public health without realizing that it is everywhere, especially on social media. If you think about it, when you pull down the top of your feed and wait for various outcomes, the information that could populate will randomly load like a slot machine while you wait with excitement, ready to be entertained. If you are lucky, you will see endless posts from family and friends celebrating their accomplishments, birthdays, marriages, and bundles of joy. Unfortunately, some of that luck may be tainted by an undesirable event or information, like those mentioned earlier. All of these events will have the potential to influence your attitudes, beliefs, and behaviors as they relate to your health. While we mention their influences, we want them mostly to be positive, but of course, sometimes the negative influences prevail. Since this is often the case, it is important to have safeguards to protect yourself, your mindset, and health. I have developed what I have called the Healthy Mindset Safety Net. It is combined of 4 practice areas that I believe will help others navigate the negative effects that they may encounter while online, and most importantly, learn how to prioritize their health. The first practice involves simply taking a break from social media. The break can be for as how long as you desire. I normally encourage people to start with a day and then advance to a week. The goal behind this practice is to identify alternative methods that are positive to help you remain mentally engaged outside of social media. The second practice involves replacing social media with mindful activities. These activities could be going for a walk, doing yoga, or engaging in a 15-minute session of deep breathing. The third practice involves acknowledging how things that you view on social media affect your mental health. After acknowledging this, allow yourself the opportunity to react. If you need to cry, cry. If you need to scream, scream. The idea is that you release this tension and frustration built up inside of you. The fourth component of the Healthy Mindset Safety Net is to seek help. This help can consist of gathering community resources, obtaining a mentor, or searching for a therapist. The goal is for you to establish and maintain a system of support that will help you combat negative experience both online and offline. I just suggested to you a few ways of how to prioritize your health during a time where negativity is constantly being highlighted. There are many other ways to address this as well, but the key thing to remember is that it starts with you. You must decide how you will allow the information to affect you and how you show up in society, and how you allow these things to influence you as well. Regardless of what you decide to do, remember, you live in a time where public health related events and information has gone social. Instead of allowing it to negatively hold you hostage, free yourself by protecting your peace, promoting your health, and most importantly, prioritizing you. I am Jamie Means, a public health and communications consultant. Thank you for coming to my TED Talk.